please help spread the message of Frequency Specific Microcurrent by clicking on the like button. You can subscribe to us on YouTube or any podcast app. If you have any questions, please leave them in the comments. You can find the podcast transcription at frequencyspecific.com, as well as more information about Frequency Specific Microcurrent.
There she is.
And there you are.
Hello.
Hi.
How are you?
I'm good. I missed you.
I missed you too. You know how you have road signs here that say deer crossing and things like that? The road signs in Costa Rica were sloths, 3-foot long iguanas, and deer. And that's what you had to be careful, was crossing the road in front of your car. It was 80 degrees and it's still the rainy season. So they had drizzle and then downpours and then sun, all in the space of an hour or two. But it was still 80 degrees. When it drizzles and downpours in Portland, it's 47 degrees. Yeah, it was awesome.
Yay.
They have blue butterflies.
And I have my butterfly picture in the back. The butterflies are extremely symbolic for me. So I would have loved to see big blue butterflies.
I brought, it's downstairs and now I can't leave and go get it, but I got a blue butterfly in a glass frame.
Wow. You can bring it for show and tell next week.
Okay. I will bring it for show and tell next week.
So what did you do in Costa Rica? Let's hear all about it.
I went to visit Anamaya, which is a yoga retreat center. Joseph Mikret, I think I'm pronouncing his name right, invited us to do a course seminar. He read the resonance effect, said we should offer this as a therapy at Anamaya. And Anamaya is a yoga retreat center. It sleeps 32. It started out as somebody's house. And then over the last 15 years, these guys have built, Joseph and his business partner have built sleeping room cottages down the side of the hill until there's sleeping room for 32 people. And then 2 teaching room spaces. And it's just gorgeous. Every place you look in Costa Rica, there's art. If there's a blank wall, they paint flowers or leaves or something on it. The trees, everything is green. Everything, it's flowers. Anyway, so we are doing the core. Their yoga pattern is you check in on Saturday, you start the course Sunday, Monday, Tuesday, you take Wednesday off to go surfing or swimming or just lay about or get a massage or do whatever. And then you finish up Thursday, Friday, then you leave Saturday. So we talked about how to structure that. And I said, what if we booked Anamaya for 2 weeks? So we'd take the Saturday and then maybe we could do an FSM rehab course on Sunday, Monday, Tuesday. And then maybe we could take Wednesday off and do a masterclass Thursday, Friday, and then leave on Saturday. So half of the sleeping room spaces are already booked for that second week, but the sports or the rehab and the masterclass are usually smaller. So I thought, okay, what if we had just 15 or 16 of the rooms instead of all 32? And so we have to work that out. And I told him I'd check with you and see if you'd like to come down and visit Paradise. Yeah.
You did a fabulous job of posting on social media, which was making everybody feel like they were there. It won't take much convincing to get me to come.
The roads are really pretty awful in certain areas, but then the road from Montezuma to Liberia Airport. It's a 3.5 hour drive, but it's all on paved road with no potholes. So that part was good.
You always bring us back to the positive piece of everything. That was good. And that's positive.
That was good. So there's just no words. So there's
People.
artisans along the street. They just set up their little tables. And this is carved jade.
Wow.
Yeah. And it feels good when I wear it. So I put that on today.
Looks good.
Yeah,
Not like it looks stylish, but it looks like good.
powerful.
Yeah.
That's
But
what it feels like. It's
good, powerful.
good.
Sometimes powerful can feel scary, or it could feel, but that is, I want to talk about feelings today a little bit, actually, but we can circumvent all of that in a little bit. There's so many questions that came in to me over the last little while that I've put off until I could talk to you about it, because it is more to do with non-sporty things. But as we talk about, everything is connected to everything. I'd like to go to a list a little bit at some point today.
Go for it.
So one of the first things as we are entering cold and flu season into the fall is the immune support protocol. Now, we
Yeah.
talk a lot about the flu respiratory virus protocols, but we don't talk so much about immune support protocol itself. I know for when I program custom cares for athletes, I typically say run this at least once a month. And then as their sports season gets more and more intense, sometimes you're running it more and more. So like towards the playoffs, maybe you're running it every few days because you're playing every second day. You're on airplanes, you're run down anyways. I don't know, is there a recipe that you like, or a formula as far as running immune support? Do you run it yourself?
Actually, don't. I plead guilty. Maybe I should, but I don't get colds. I
Yeah.
run concussion in Vegas every night.
So this is what I think where we are shifting, because we didn't talk about the Vegas so much 5, 6 years ago, everything else. And so I always hear your voice saying, I'll let the Vegas decide what to do.
Yep, that really is. It's if a virus shows up on the horizon, the Vegas will stop controlling the immune system, and the immune system will do its thing. Increased secretions in the immune system, theoretically, assuming the frequencies are doing what we think they're doing, increased secretions in the immune system will support immune system function, we think.
Right.
We know for sure, the only data we have says that we can suppress inflammation by doing 40 and 116.
Yeah.
We don't have any data that says 81 and 49 will increase immune system function.
Right.
I'm the data guy,
Yep.
right? There's that. It doesn't hurt to run it. Think of the immune system as a circulating nervous system,
Mhm.
and you can do that. It's a really good question. I think maybe my problem with immune support is, yes, I made a theoretical thought experiment about immune support, and I did a thought experiment with concussion in Vegas, or just vagal tone.
Mhm.
I haven't had a chance to tell you. Did I tell you? I didn't tell you. Okay, you're sitting down, right?
I am.
Okay.
With 2 dogs sleeping at my feet.
The patent has been filed by Tivic, the company that is designing a device, an external vagal nerve stimulator, doing just the short version of the frequencies we use for vagal tone,
Mhm.
right? And because the patent has been filed, the data from Feinstein Institute is now public. That's a good face. And I put Jennifer Ernst, the CEO of that company, and me on the symposium schedule. to present the data. I haven't seen it. I'm going to do 30 minutes to remind everybody what the vagus does,
Yeah.
not the long version, but just the relevant version of what the vagus does. And then Jennifer is going to present the data. It was enough to get us a patent.
Amazing.
Yeah. So if you weren't planning, those of you that are listening, if you weren't planning to come to the symposium, it might be a worthwhile trip to do that.
Absolutely. Yeah, that is what you want to be live for, to see in person. That's amazing.
I'm so excited.
No
It's-
kidding.
And then Juliana Mortensen is doing 90 minutes, and I asked her for the title, and it's Sparks,
Ooh,
Sparks of Life.
that sparks.
She just does the history, the biophysics, and then circles back around to how it relates to FSM. And she said, no, 90 minutes is right about right.
Good. And that was one of the very first things from the very first advance that I remember is follow the spark. And I think about that every single day. It's just,
Follow the spark.
that's a great working title. I love that.
I'm excited.
So
So
going back to the Vegas though, we have to get back
back to Vegas. Yes.
and immune support, the immune support protocol. So if we think of the vagus as the almighty, the omega, the powerful, right? I do. I respect the heck out of what the vagus does for us. But when I think about immune support, when I think about even just trying to keep my own children healthy, and I think of the athletes I work with as my teenagers, as my children, my first question is, are you sleeping at night?
Yes.
Because it doesn't matter what we're eating, what we're training, what we're reading, what we're praying for. If you are not sleeping at night, everything else is a wash.
You got it.
When I think about immune support, I think about how are you sleeping at night? And if I want somebody to sleep at night, I'm saying concussion in Vegas.
Yeah.
Half the time, more than half the time, 90 whatever percent of the time, if they're running concussion in Vegas within an hour of bedtime, there's no second program because you're sleeping.
Yes.
And you are sleeping very well.
Yes, exactly.
Yeah, I think immune support is great and I don't think it hurts. And I think a lot of people that I work with to have a regime. So they like to have a program to follow. So run this after a workout. Once a week, I run this. Every 2 weeks, I run that. If I feel like this, I run that. So I will continue to put immune support in there because it's that.
And the thing is that assuming that we're doing what we think we're doing and we do support immune system activity, if for any reason the immune system needs to be suppressed, if it needs to be suppressed, the vagus is going to take care of it.
Right.
Vagus will turn it down faster than you can turn it up.
Right.
And so that makes it safe to run it as long as you're running concussion and vagus. Balance each other.
I feel like the same goes for, and we talked a little bit about this with Dr. Sosnowski and Dr. Musnak about autoimmune conditions. And yes, you can, I don't want to say chase the symptom, or you can make sure the vagus is doing its job, and then the flares of everything are almost secondary. I don't mean secondary, but like the vagus has to be involved with everything.
The vagus has its job to suppress the immune system.
Right.
Once I saw the connection, every autoimmune patient I've ever seen, there is some infection, stress, or trauma within 1 to 3 months prior to the onset of the first autoimmune system. So the vagus gets turned down by infection, stress, or trauma. And so the immune system stops being suppressed. And the immune system decides that you're synovial joints belong to somebody else. So then you get a diagnosis of rheumatoid arthritis. We still have to treat the joints.
Mm-hmm.
But in order to quiet the immune system, you've got to figure out what turned the vagus off to begin with and fix that, fix the vagus. So at least then the immune system is back under control. And then it's just a matter of, you can't put tissue back that's not there,
Right.
but you can slow down the flares.
This will piggyback on the other question I had. It was regarding herpes. Does it work with herpes 1 and 2? How often would you run it to prevent a flare? I would imagine it'd be the same thing. Stress causes lack of sleep. There's so many things that are involved if you have herpes 1 and 2, right? So are you sleeping at night is my first question. What is your stress levels like? And I don't know much about, I know the slides that we have on herpes were, and we typically talk about when there is an active flare. I don't know how it works with reoccurrent flares or preventing or maintaining or.
I have one patient, I have an N of 1. Don't take this as gospel, but I have an N of 1. And he was so paranoid about his recurrent genital herpes that he insisted on running it every day. And I said, no, wait until you get the prodrome where you know you're going to have a lesion. Then you know the virus is present. And just, we know for sure once the virus is present, it'll knock it out.
Right.
Well, he ran it every day, and he actually gave himself an outbreak that we couldn't turn off. I have an
Wow.
where you don't run it for prevention.
Yeah, but I think, and this is where I don't think virus discriminates. Again, like if our immune system is healthy, if we are sleeping at night, if we're managing our stress levels, if our gut is digesting the food that we want, these are the things that we can fixate and again, try to control it. If you have herpes in your body, you're not getting rid of it. So let's do everything you can to support a healthy environment so that it doesn't decide to.
So it's suppressed. The immune
Like
system,
the autoimmune stuff that we talk about.
the
Yeah.
immune system is keeping it suppressed. And when you're not sleeping or you get stressed, the immune system stops being effective. And all of this leads into Musnick's hour. Isn't he doing an hour on sleep?
I think it's no, I think it's longer than that. I think I'll have to double
Doing
check.
the 3 hour block?
Maybe it's the 3 hour
The 3 hours on sleep and then
and then 90 minutes maybe on the other or an hour on the other. It's 3 hours on sleep because he has so much amazing information on it. And who doesn't need to hear all of it?
and if you've already heard me, you don't need to hear me. Go hear David talk about sleep. That would be fun. And
Yeah.
then I don't have the schedule in my head. We'll post it. Now that it's almost complete, we've actually almost filled up all the case report slots. And Eduardo is doing an hour on the Dura.
Yes, you talked about that last podcast. I can't wait because the Dura, I feel like, again, you don't have to be a cranial osteopath or a craniosacral therapist to understand the power of the Dura, and to have him explain it is going to be a treat.
I'm so excited. One more core in December.
Yeah.
And we have a sports in November.
Yeah, so there's still time if you want to come hang out with us in Portland at the beautiful Troutdale Center, because the in-person small classes are really where it's at, to touch and feel and to share and to see it and experience it. There's nothing like it.
This time, are we doing FSM rehab for the 2 days? So have you modified the sports so it's more for the average, how do I walk down the street or climb stairs
Yes.
and reach up and pick up a cup? It's the same activity.
Yes. And the sports advanced is going to be taking that and making it a little bit more applicable to sport. But it really is FSM movement, right? Like it's rehab and movement.
I like that.
Thank you.
Rehab and movement. Very good. Yay.
Because I think all of us in healthcare and what we are doing, I think our goal at its like primal level is to help everybody move better, whether that's getting out of a chair better, whether that's walking down their hallway to get a cup of coffee in the morning, whether that's running a marathon. It's all the same. It's movement. We need our bodies to move pain-free, safely, and effectively. And in that order.
Yes. I tell you about one of the most amazing, fun cases I've ever done in 30
Please do,
years.
because this is my favorite part of the podcast is listening to the stories.
Okay. So this lady came up 2 weeks ago. She's a friend of a friend, and I just snuck her in on a day when I wasn't supposed to be working because she was on her way to Southern Oregon to pick up a mobility dog. She has been in pain for 10 years and diagnosed with myofascial pain syndrome.
Yes, I've heard of this from my rheumatologist.
And she's headed down to pick up this dog that has been specially trained for her for 3 years, specifically for mobility. He's learned to stand when she puts her hand on his back so she can reach down and take her shoes off. And so she arrives for the first visit and she has no triceps reflex on one side. She's hyperactive patellar reflexes on both knees. And her pain diagram shows that the psoas on both sides is just rock hard.
Yeah.
So I treated scarring on the ureter, scarring on the kidney, treated disc repair on the neck, concussion in vagus, and she left with her pain at a 0.5 instead of a 5. And then she went down, she picked up her dog, and she came back yesterday. And yesterday, redid the reflexes, no triceps reflex on the left, hyperactive patellar reflexes. And oh, that was the other thing. She said, it hurts when I walk, it hurts when I sit, it hurts when I stand. What does that
And
say?
where was her pain? In her back?
Huh? Hurts when I sit, hurts when I stand, hurts when I walk.
Okay.
She has sprained SI joint.
Yeah.
So I laid her on the table and I pushed on her right SI joint, just boink, nice and firm. Left SI joint, smash. So I just, the first visit and yesterday just ran 124 and 77 across her SI joint. And then I happened to feel the tone in her legs because she said, I always feel like I have a corset on because her psoas wasn't bad, but I always feel like I have a corset on. My muscles are so tight. And then I felt the tone in her left leg versus the tone in her right leg, the tone in her back and her chest on the left. And it's her left triceps that's missing. You see where I'm going with this? So yesterday I ran 81 and 10 and taught her to take a deep breath and ran 40 and 89 for 60 minutes. So she's not afraid of her body anymore.
Yeah.
Then we ran increased secretions in the sensory motor cortex while I had her learn to contract her lower abs. And then increased secretions in the cerebellum. And with 40 and 89, quieting all that trauma and pain in the midbrain and all the childhood difficulties she had, the look on her face changed. The person that left the office yesterday was completely different. She was confident. And somebody who walked in being 2 weeks ago, being afraid of her body because all it did ever was hurt. I put her on the reformer with just half a spring and had her extend her legs, straighten her legs. I call it the slidey thing. She just used her legs and she said, it doesn't hurt. I love moving.
Mm.
And I said, and if you don't need a mobility dog, you have a wonderful pet. To be able to change somebody's life like that, so predictably, so easily, because during the session, I would say, it can't be this easy. She said,
Right.
nobody has ever said it's easy. And I said, they just don't have the tool. It's not their fault.
And a big part of what you do also is the pattern recognition that we talk about. You have the hypothesis, you compare that to what the patient is presenting with whatever kind of data or imaging that backs it up. I want to talk about the reflexes for a second because we talk about reflexes a lot. That was actually one of my questions. The person had said, I remember way back when getting reflex tests at the doctor's office. I don't remember the last time my doctor ever did a reflex. So can you talk a little bit about hyperreflexes for a second before I go any further? Just for the lay people that are listening and actually the practitioners that are listening, because there's a lot of people that we learn it and then we skip over it sometimes.
So there's a scale. +1 is reduced, +2 is normal, +3 is hyper, +4 is clonus. You get a reflex and it won't stop.
Yeah.
So if there's a disc bulge in the neck, let's say, or the thoracic spine, any place there's a spinal cord, inflammation in the spinal cord slows descending inhibition of a reflex. So the upper reflexes, the biceps, the brachioradialis, and the triceps, those represent or demonstrate whether or not the nerve root that innervates that tendon is compromised. So if it's really inflamed, it's going to be reduced. If it's really inflamed, it's going to be absent. If it's normal, it'll be a little brisk. If there's a disc bulge above that nerve root, it'll be hyperactive. Or if the patient is hyperthyroid, or there's some other things that'll make it hyper. Anyway, so that's the upper reflexes. But the patellar reflexes, if there's inflammation in the spinal cord, there's a constant dial tone that comes down the spinal cord that dampens the reflex and keeps it down to a +2.
Mm-hmm.
If there's inflammation in the cord, conductivity is slowed. So it can't get to L3 in time to dampen the patellar reflex. A hyperactive, where instead of just doing bonk, it goes wow. That is +3, and that means the spinal cord's inflamed. I actually had an MD tell me that she'd never heard that before. And it was a neurologist, Bob Grimm, taught me that.
Mm-hmm.
Then the Achilles is, for whatever reason, not affected. So it's really unusual to have a hyperactive Achilles reflex.
Mm.
But if the spinal cord is really inflamed, you'll get 1 or 2 beats of clonus. When you pop the foot up, the foot will bounce once or twice.
Mm.
So you record +1. They'll have clonus on one side, but not the other. And that means that the disc is one-sided. Pretty much with reflexes and sensation, you should be able to predict what the MRI is going to look like, where the disc is, what it's pressing on, how it operates. She had completely normal sensation. So the disc in her neck that produced increased tone all the way down the left side
Right.
had to be purely central because she has no nerve involvement, and posterolateral discs hit the nerve roots and create hyperesthesia or numbness.
Mm-hmm.
Hers had to be central. And I did 81 and 10. So she left with a custom care and a magnetic converter. I said, the only thing you have to run with these wraps is body tightness, tight body. that corset, because she left and she could breathe. And she said, when do I run it? I said, when you feel tight, and you're
Yeah.
10 years, you've been feeling tight, so you're used to it. The challenge is get used to being loose, and when you feel tight, treat it. Yeah,
That's a really important concept for people who have had a chronic injury or chronic illness or a chronic anything. You get completely used to running it. And then that's the reason why 1489 became such a important frequency to run even during treatment, before they move, before they get off the table, because we can assume, I think with quite a bit of confidence, that they are going to stop at that barrier that used to be there that created pain, because we're smart. Why would I blow through a barrier that created pain? Why would I move this way when that creates pain? And then when you remove that pain as quickly as we do, there is no way everybody's going to get on the same page again and be like, oh yeah, that's safe. That's not going to hurt. I'm just going to do this. Once in a while, you do get that patient that's, more often than not, you're not getting that response.
And if pain is the normal thing for you, when it gets better in the office, and even if you have a custom care, gets better in the office, and then 5 days later, you feel tight again. I've been tight for 10 years. That's my normal state. And you almost forget that there's a solution for it. And sometimes they just forget to run it because tight is normal. It's
Right.
uncomfortable, it's painful, but that's who they are.
Yeah.
But I use the fact that patients on the table are hypnotized.
Yeah.
And I made eye contact and put my hand on her shoulder and said, this is not who you are anymore. This now, relaxed, pain-free, comfortable. This is normal. And you just touch their shoulder and there we go. It's pretty fun.
That is a very important statement, I think, to make to people, because they do self-identify. I think working with athletes as well, and it's not even a professional athlete, somebody who is a runner self-identifies as a runner. And there is fear and panic and terror when they have an ailment or a condition that is preventing them from running. And right away, what am I going to do if I can't run? There's 100 other exercises that you can do in the meantime, but it is what they attach the identity with the condition, right? And so to be able to reframe that, I think, is a really important concept. We talked about mantras a lot with Peter Twist. We talked about it with Dr. Musnick even. And so I think even posing the question of, when you are recovered from this, what does your life look like? Tell me what you will do, instead of how much pain are you in? I get it, but what is the goal, right? What would you like to do? And go there and talk about it. I'm going to pick up my granddaughter. I'm going to go for a walk with my spouse. I'm going to put the mug on the top shelf of the cupboard for the first time. And what does that feel like? And smile about it and attach something positive to it.
Mm-hmm. Yeah, let them create a picture. I found a tape. I need to do either a webinar or an hour at the advanced with slides on hypnosis and everyday clinical practice, but I've never made slides about it because I didn't know how to make slides about it. And then I found a tape of a lecture I gave to the American Association of Naturopathic Physicians. I don't have the slides, but there's a lecture. So I can take the lecture, listen to it, and make slides and figure out how to talk about it.
Yeah.
Because I took the course on hypnosis and clinical practice when I was 28 from the San Diego Society of Clinical Hypnosis, and they were all MDs. And they use it in their practice. And every patient we see is hypnotized. And then learning to use that deliberately is really powerful.
Yes. Oh, I just lost it. See, this is why I need to write things down when you're talking. Patient reframing. Oh, the reformer.
Yeah.
So the reformer is a great tool, and you don't have to be a certified Pilates instructor to have one, because you can start with proper mechanics. This is a big concept of the sports advanced course, is an open chain versus a closed chain exercise. A closed chain is weight bearing standing. That's when the extremity is fixated on the floor typically. So when you are horizontal, like on the reformer, and this is where we did all the amazing case studies, this is how we formulated wipe and load when we had our swimmer. The reason why we had him on the reformer so much is because he is in a horizontal non-weight bearing sport. I don't need him to be vertically loaded for proper mechanics. So the reformer is really nice when you have cables for the upper extremity and you're able to move the whole body through a chain that's non-weight bearing, because the threat of injury is very low when you're non-weight bearing. So it's a beautiful tool to have at your fingertips in those initial mechanical recreations.
When I was at New Heights doing PT pre and post my hip replacements, that was my cookie at the end of my sessions, was I got to be on the slidey thing. The reformer is the slidey thing. So when I built out the clinic, it gave me an excuse and a budget to buy a slidey thing. And I get on it and play. And I got to the point after my hip replacements where I watched them rehab prima ballerina who had broken her foot. And her final task was, with 3 or 4 springs, pushing off and leaping with her foot pointed,
right,
with both feet, and then 1 foot and 1 foot, so she could strengthen all the muscles. And it requires that your upper body be balanced and coordinated. And so that was my cookie, and that's how my little clinic as a reformer. And it's a perfect, I don't know what you know about open chain and closed chain. I just knew that having her walk as the first task was too much.
for sure.
So she needed to get to know her legs on the reformer. And then I said, now walk clear back to Kevin's office and then walk this way. And her gait was different. It was just amazing to see and to be able to do that with this as a tool. There's no other way. 81 and 10. Who can do that?
I don't know.
Yeah.
We have a little question, I believe.
I would treat the liver for toxicity. I don't know why I'd treat the liver. We have a frequency for the tongue. You could do the liver, because what comes out in your saliva is what's circulating in the fluid, and all that comes from the liver, and chemo pretty much messes up the liver unless the chemo is specific so that it's going to damage the taste buds. So then you could do toxicity in the tongue. That's a thought. Diane says the reformer would be great for patients with POTS. POTS is so easy to fix. It's really, it sounds silly when you say POTS is easy to fix, but you fix POTS by getting the vagus to work. They get up off the table and they don't have POTS. Vagus has as its job to slow the heart rate when you stand up. And if the vagus is working, so you could do concussion in vagus, you could start them horizontal on the reformer, but if you get their vagus working, when they stand up, they're not going to have POTS. At least I've never had anybody that laid down with POTS that stood up with POTS.
No mileage with that. Derek, do you feel 321/49 on A and 534 on B could help with dementia? Need something for calming down aggression?
I would do, I'm not sure what 534 is, Derek.
Neither. Thank you for when you say those things, because I always feel like after all these years, I should know, but I don't.
No, 534 is one that I don't use.
What is
Yeah,
534?
it's George's frequency for the limbic system, and it has a little I next to it, and because it doesn't work. Before I take the little I next to anything that George has scanned for, I have to have a demonstration that it actually does that part of the brain that it's described. And he's got one for the limbic system and the deep limbic system. And as far as I can tell, they don't work. 40 and 89 could work. So calming down aggression, fear, anger. We know the limbic system, the hypothalamus and the thalamus and the hippocampus are in the midbrain. And so 40 in the midbrain might work. And you wouldn't want to increase vitality, even if 534 worked for the limbic system, you wouldn't want to increase vitality and the limbic system, because the limbic system is the emotional part, and that's where aggression comes from. So what you want to do is calm down the limbic system, because what happens in dementia is as the cortex loses control over the limbic system. So we all have occasionally the desire to strangle somebody. And the cortex says, no, that's not polite. Just keep quiet. It's going to be fine. We're nod politely and walk away. That's what the cortex says. As you get dementia and your frontal lobe goes away, then the limbic system has no filter to prevent the aggression. I would go after increased secretions and vitality and reduce inflammation in the cortex to create more of a filter for the limbic system and quiet the midbrain to see if that would work, and honestly increase the vagus, right? So the vagus increases circulation, nitric oxide, and decreases inflammation and decreases all the bad stuff, decreases glutamate, increases GABA, does all the good stuff. So treat the vagus like crazy, treat the cortex to get it to be a better filter. And yeah, it's the limbic system. But Derek, do you see the logic? It's understanding. It's why during the advanced, I spend so much time on the nervous system. So you see the connections between everything. The nervous system is fairly linear. This does that. This suppresses that. This amplifies that. And this is connected to that. And everything goes through. It's linear, right?
Yeah. Yeah.
When can you run concussion and vagus after the chemo? It depends on how the cancer's doing. The vagus suppresses the immune system. If the chemo has been successful, the cancer is quiet, you'd run toxicity in the vagus. And Harry used to run just concussion, support the adrenals, emotional factors. If you've had chemotherapy, you want to treat the liver. And I'd say once they tell you that your CA 125 is back down in the normal range, then you can run concussion in Vegas, I would think. Hi, Kathleen.
We had one thing I want to touch on before we go, just because this is probably the most common thing anybody is going to treat, are sprained ankles. And I think that's why I talk about sprained ankles so much and all the time. But there is a very big difference between a high ankle sprain and a normal inversion sprain.
Oh, totally different tissue.
Exactly. So this is what I wanted to touch on, and this is what we had tag teamed the clarification on that. A normal inversion ankle is when you roll your ankle turns in and you go outside of it. That's very common injury. We don't have eversion sprains because structurally it's very hard to actually evert. We have a nice safe bony block there. So you get that inversion rolled ankle. That's the deltoid ligament gets typically really damaged, torn. What degree is up to how your injury was. But your big bang for your buck is going to be torn and broken on the ligaments. So 124, 100. And you could do 77, the connective tissue, because you've got the retinaculum can get banged up. 783 makes it help feel better too. That's a typical slam dunk. A high ankle sprain is very painful. You'll see these more with sports with rapid acceleration where the foot is planted and then there's a bit of a rotational force. So the membrane in between the two lower leg bones, your tib fib, has this beautiful fibrous membrane called the interosseous membrane. That
in both directions diagonally, there's two layers.
It's beautiful.
It's beautiful.
It's beautiful. Yes, it's beautiful. However, excruciating and can be very slow to heal because there's a lot of movement between the bones. While we are typically moving away from a lot of immobilization, you'll typically see those high ankle sprains in a boot or a walking boot a little bit to just keep those two bones a little more still so it's not as painful, but you want to be not as focused on 100, but you want to shift your focus on that B channel to 77 and 142 and 783. But it's just a very big, it's a small difference, but a very big difference in your focus because of the anatomy.
And that's why Netter is your friend.
Yes.
You look up the interosseous membrane and you can see connective tissue, not ligaments, even though ligaments connect bone to bone.
Yeah.
The interosseous membrane is connective tissue that connects bone to bone.
Right.
And
the membrane.
It's a membrane.
So when you see words like band, retinaculum, membrane, those should be like jumping off as connective tissue, 77, and fascias everywhere. So I feel like I'm running 142 just all the live long day right now because
Yep.
it's
Fascia is your friend, connective tissue is your friend.
yeah.
There's a comment over here, and this relates to what Derek was asking. Susan Jewett says 40 and 89 worked very well in my experience for anxiety in dementia and Alzheimer's. It's very calming for the person. Part of the reason that dementia patients get aggressive is they're terrified. The big system, it just sees threat and everywhere, and it goes back to the very primitive emotions, anger and aggression, but it comes from anxiety. And thank you for the corroboration that 40 and 89 would be a good thing to do. But yes, same thing with, you're welcome, Derek. Same thing with the high ankle sprain, because that is one place where an orthopedic surgeon will actually put a screw through from the fibula through the tibia at an angle, and that screw is to be removed. But from a surgeon's standpoint, you have to immobilize those two bones so that interosseous membrane can heal, because otherwise they move, and every time they move, the connective tissue gets disorganized.
Right.
And they need to line up and get strong, those two bones together.
Yeah, I have a bit of
yeah.
a smirk on my face right now because I've been so successful at treating high ankle sprains that people have gotten into trouble because the next day the pain and the swelling, especially the pain feels like it's almost gone. Oh, I don't need this and I can keep walking. And I'm like, but healing still needs to take place. And I'm glad that you feel great, but you still can't go running today.
No.
But no buts. No, it needs to heal. And like you had said, if you open Netters or you Google it, it runs in this crosshatch pattern. And so because it's trying to distribute the forces between those two bones, so it is typically the harder sprain to heal, but it doesn't, again, I think it's just quite easy when you just shift your focus on, again, what is the tissue, right? And that goes back, that's like FSM 101. What is wrong and where is it occurring? It's torn and broken, or we need to repair and heal. That's our new phrase for 124. It needs repair and healing, but it's not like a round ligament or ligament proper. The membrane is a different kind of beast altogether.
And the other thing with high ankle sprains, at least the few that I've treated, is that it's really difficult to tear or strain the interosseous membrane without beating up the deltoid ligament at the same time.
Absolutely. Yeah. It doesn't get damaged in isolation, right? And again, it's just like everything with FSM is recreating the story. How did we get here? So it's what's wrong, where is it occurring? But the other part of it is, and how did we get here? So yeah, you're right. It's like having a concussion without having the neck involved.
Exactly.
I go a little crazy when I hear, no, it's just a concussion. His neck is fine.
Like the head isn't connected to the neck?
Like the head just levitated and hit something without the neck doing something. Sure, the neck's fine.
Yeah, we're not even going to look at the neck. It's okay. That's the other thing with concussions is they don't check the inner ear. Concussion. Where did you get hit?
Yeah.
Oh, back here. You mean on the temporal bone, right over your inner ear?
And we shouldn't check the jaw because the jaw was just super happy and relaxed as this incident was happening. Sure.
No, and the last class that we did in Troutdale, there were 18 people and 20% of the class had vestibular injuries.
Yeah, amazing. Not surprising, but
And none of them knew it.
yes.
And I handed out the BIVSS to the whole group, and the ones that filled them out, 32 over 18, 46 over 18, 27 over 8, they just took the test. And
Yes.
oh, that's what's wrong. And 40 and 44 works for that.
Yes.
It does. It takes the symptoms down. That's good. It can't be 4 o'clock already.
I don't want to go.
I don't want to go.
I'm glad you're back. And
And we'll be back next week too.
yes. And then we're in person the week after that.
Ah, that's right.
Yes.
Oh, that's so exciting.
I know.
Yay.
All right. Have a great week. We'll see you next week. And we've still so much of that list to go through, but whatever. We'll get to it.
Get some of your list done?
Yes.
Okay.
I can sleep tonight knowing some of the list is.
I worry about your list sometimes, just so you know. I think about your list. It's like we need to get the little check marks done. It's okay.
Well, I think it's good the list keeps growing, that because we want to keep asking questions and we want to keep moving. We don't want to stay stagnant. So the list should be continuing to flourish.
Agreed. There's always the questions. This is good. I love the list.
Calm voices amidst the chaos. Thank you. We aim to be the calm voices.
There it is. Thank you, Melanie. Calm voices amid the chaos. Amen. We're not even going to go there.
No, we did so well. We didn't even, podcast is over. See you next week.
Ready. See you next week. Do good things, save lives, change the world.
The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.